Thank you, Professor Kumaraswamy and the Middle East Institute Delhi team for giving me this opportunity. And I can see my teachers, Professor Girijesh Pant and Professor Gulshan Deaton, all of them are listening to are here to listen my small talk. And I'm really privileged. It's a great privilege that you have invited me here. The southernmost state of Kerala has a fascinating history of migration. By the 20th century, with the introduction of colonial economy, that has prompted Malayalis to migrate different parts of the world, particularly to East Asian countries, to former Malaya, that is the present Singapore and Malaysia, and to Ceylon, and also to Sri Lanka and to Burma. Why they have migrated in the 20th century? I will tell you a very brief account of that. By 19th century, 20th century, with the introduction of the Western education, there was a skilled, educated class was developed even in the beginning of the 20th century. But a major chunk of them were denied jobs in the Travancore kingdom because of many social and caste issues. So they had to migrate different parts of the world. Even after the independence, what we have witnessed in Kerala is a spectacular spread of education. Because of the education, and what we could see that the Malayalis and Keralites started migrating to different industrial states within India. That means for Hyderabad, Chennai, Mumbai, these places the Malayalis started migrating. And around 60s, 50s, 60s, this was the phenomenon. And by 60s, 70s, there was a migration, 60s, there was a migration towards Africa, and also a nursing migration to Europe. And then we could see the major oil boom. The oil boom was blessing in disguise for Malayalis because late 1970s and the mid 80s, there was an economic stagnation. So Malayali migration was able to overcome this particular stagnation. So therefore, out-migration and remittances made a remarkable change in Kerala's economy, society, and polity. As a result of migration, there is a drastic change in the economic and social sphere, which in other words created a money order economy. The much acclaimed Kerala model of development and development bases, many analysts and experts believe that that's all basically because of remittances. And remittances made a deep impact in almost all the sectors. The most important sectors, the remittances had a remarkable impact were health, education, savings, consumption patterns, real estate, housing. If you look at any sectors, any cultural, socio-cultural spheres, there is a deep impact of the Gulf migration. But one thing I want to highlight here about Kerala, that is Kerala's labor market is characterized by excessive supply of labor from India, from Kerala to out, that is the out migration. In other words, what we call is an educated unemployment. Since 1947, even till today, this is sort of a phenomenon within Kerala, that is educated unemployment. Even by late 1990s, if you look at the data of Kerala migrant or Kerala to Gulf, we could understand that there is a rise of higher secondary educated class within this migrant group. I'll come to that problem of when we talk about the reintegration, I'll come to that part. So there is always this educated, the skilled, and also higher secondary migrants within the migrant stock from Kerala. So I will just, to give you a brief history, Kerala migration started with just 1 lakh in 1981. And 1990, it was 5.3 lakhs. 1998, it was 13 lakhs. And 2012, it peaked to 24 lakhs. And now it is around 21 lakhs. But the interesting thing is, there is a decline from 24 lakhs to 21.2 lakhs now. That in any way did not affect the flow of migration, flow of remittances. If you look at the flow of remittances, we could see around 1980-85, it was 536 crores, and it jumped to 18,000 crores in 2003. And 2013, it peaked to 71 crores. And now, 2019, we have 95,000 crores as remittances we received last year. That is roughly around 15 billion US dollars Kerala received as remittances last year. That is around 19% of the total remittances what India has received. India received around 80 billion and Kerala got around 15 billion. That is nearly Bangladesh's remittances. If you look at the South Asia remittances, South Asia received around 140 billion last year, 140 billion US dollars, out of which 80 billion around India received, around 24 billion Pakistan received, 18 billion Bangladesh we got, and 6 billion, I think, Sri Lanka, and 8 billion for Nepal. This is actually the statistics. So Kerala received almost 15 billion US dollars. But the real issue, what we are going to talk here, because that this for 4 minutes I have given a brief introduction. But the real issue now is about the COVID-19 and its impact. See, we have to understand one thing. Return of migrants is the centrality of the Gulf migration. The main characteristics of Gulf migration, especially in South Asia, is it is circular and transitory in nature. Why it is circular and transitory in nature? Because the migrants are going there only for a stipulated period of time, particularly the non-skilled and semi-skilled ones. They are going there for maybe 8 years or 10 years or 12 years. Then after 10 years, they have to return back. So that means every year, a set group of migrants are going to the Gulf and another group of migrants are returning back from the Gulf. So it is circulates and it will transit. So therefore, the Gulf migration is transitory and circulatory in nature. Myron Wiener defined it as an incipient diaspora. Incipient diaspora means people are going there for a particular period of time. It's basically labor migration. They don't have any political or a constitutional rights. Eventually, they make money and they will come back. That's what the one theory about the Gulf migration is. But Kerala has witnessed 3 major reverse migration. That was 1990. It was Iraq-Kuwait war. Migrants have to return. 2008 recession, and after that Nitakat. These are the 3 main reverse migration Kerala, I mean, even to some extent in other states in India also had witnessed. But in those reverse migration, even I did my field research in Kuwait, even during the Iraq-Kuwait war, 10,000, nearly around 10,000 Indians did not return. They said, going back to Kerala or going back to India, what is wrong? What we are going to get? Anyway, we are poor. I did my anthropological field study, and one migrant told me, I have debt. I had 2 sisters to get married. My father is sick, so I thought I'll stay back here and work for whichever company, whether it's Americans or Iraqis. I was ready to work, and I worked. So this was the situation. 10,000 did not return, but COVID-19 is quite unprecedented. And also there is one more thing in this South Asia migration. One of the characteristics of South Asia migration is social networks. We should never forget. Social network is a migrant is reaching the Gulf not through the government, but because of his social networks and peer networks in the village, in his family and or in his church parish, or in other things. That is where he gets this information. Even after reaching there, he is part of this larger social network. Losing his job, he will not return back suddenly. He will try to stay back or he will go get accommodation with his neighbor, is his friend. So the social network is very vibrant. But COVID-19 was unprecedented. COVID-19 actually restructured and rerouted the migratory patterns. It has rerouted the migratory corridors. COVID-19 exposed the already existing vulnerabilities of the Gulf migrant. COVID-19 has exposed the exploitative terms of the kafala system. And the COVID-19 has resulted in unemployment, underemployment, non-payment of wages, non-payment of dues. Even the compensation for the death ones were not paid. There is a big campaign now going on among the migrant activists and the migrant scholars called the wage theft. I want to mention it here particularly. Even in the Iraq-Kuwait war, I have witnessed this. People narrated to me this. That is, whenever there is a crisis in the Gulf, the employers will take it as a pretext, immediate to retrench all the employees they have. They try to dismiss all the employees so that they don't have to pay any dues, they don't have to pay any salaries. This happened in Iraq, invasion of Kuwait, and this is happening now also. There are hundreds of migrants have returned without having basic pay for nearly 6 months. Many people did not even get the compensation. Many people did not even get the basic arrears. They did not even get the provident funds, nothing. They just came empty-handed. And that is a campaign which is going on now called wage theft. It is actually the wages of the migrants have been stolen. So it's called wage theft, which is going on now. As far as Kerala is concerned, I want to highlight one thing about this vulnerability of the Gulf migrant. That is, the Gulf migrant is one of the few labor stocks in this world who is working without any social, any safety net, any social protection. They don't have. They don't have any kind of even a proper medical protection. Why I say they don't have a proper medical protection? That because in the month of March and April, when there was a discussion about the Prawasis, they have to return, and all the issues were discussing in the main news hour of the televisions. The television channels have given them the opportunity for some of the migrants representatives to speak, to come in the news hour and speak. And I want to highlight one thing. They were not asking for food. They were not asking for vaccines for COVID-19. They were basically asking for medicines for the lifestyle diseases. Lifestyle diseases, that is cholesterol, blood pressure, diabetes. Some people have kidney issues. Some people have liver problems and other issues. Then the whole world and administration came to know about the shallowness of this whole employee-employer, this all contract which they sign, even about the shallowness of the medical protection and the insurance which they sign. What is the reality? Reality is that their medical insurance is not adequate enough for them to buy medicines in Gulf, which is very expensive. So when they come to Kerala, they carry a stockpile of medicines. When they reach there, they use it for 3-4 months. Then some friends or relatives will, when they come visit Kerala, then they will take these medicines, and for next 4 months. So this is a situation, my friend. This was a situation. So Kerala government, Norca, which is the department, Norca, made special arrangements for special cargo and courier to send these lifestyle medicines for lifestyle disease to Kerala. This is what is the reality of a Gulf migrant. Because when you talk about development activities, when we talk about the development, we talk about Kerala, the Indians' contribution in building the Gulf, but migrant as a component, that is missing actually from the migratory debate and migratory discourse. So therefore, I want to highlight, the harrowing experience of migrants during the COVID-19. South Asian workforce, which was the backbone of the Gulf economy, Gulf developmental activities. COVID-19, we have seen they were on the roads to nowhere. They were begging in the street. Voluntary organizations were providing them food. So this was actually the situation. Now I want to give you some data. As of now, when we talk about last week, how many people have returned? If anybody is interested, they can take down. Around 44 lakhs have returned from all over India. Around 44 lakhs have returned from different parts of the world. Around 44 lakhs. In Kerala, last week, that is 12th January, 8,94,405 migrants have returned. Out of that, a major chunk is from Saudi UAE, that's around 5 lakhs. Saudi Arabia is around 1 lakh 18,000. Qatar is around 81,000. Oman 78,000. Bahrain is around 29,000. And others we put together around 46,000. So this is the data of last week. As of last week, how many people have returned. Now, there is also data. There is a Jagrata portal because everybody had to sign or had to log in, and then they have to register in a portal of the Government of India as well as the NORCA. NORCA is the non-resident Keralites organizations. So they have given, and in that portal there is a they have to write why they have to return. What's the reason of the return? So reasons, there are 4 or 5 reasons. Number one is job loss. Around 6 lakhs people have registered their lost job. Senior citizens were around 21,000. Children below 10 years are 51,000. Pregnant women are 11,000. And then others are around 2 lakh 16,000. So this is actually roughly the data available now with the government. Now, what we are going to do with these 9 lakhs? How we are going to integrate them? And what is our action plan? And I want to tell you, right now there is a honeymoon is going on. In the sense they just came, they are settling down, they are back with the family. They are so happy that they didn't die in Gulf because of COVID. So in a way, to assess their real impact is a bit difficult at the moment. But as far as the government of Kerala is concerned, there are 2 major plans how to deal with these returnees. Number one is re-migrate. That is basically upskilling and reskilling the migrants who are here. If they are interested to go back, their skills will be enhanced. So there are major programs which the Kerala government, sort of developed. There is a Kerala Academy of Skill Excellence. So in that institute, the migrants who are interested to sort of enhance their skills can come and join. 75% of the fees and other things the government will pay. So basically, it is a multitask employee to make employ a driver, technician, plumber, everything at the same time. So this is the one sort of a program which the government is having. And also for the women and especially for the nurses, we have an institution called Nursing Institution of Career Enhancement. Nursing Institution of Career Enhancement. That means if the nurses, they want to go back, they have to write regulatory exams in different countries. They have different regulatory exams. So this institute will actually train these nurses and equip them to write the exam. So this is also a part of the larger re-migrate program. But real comes the rehabilitation. Rehabilitation, that is a major task. Last week was the budget. The finance minister has announced 100 crore for the rehabilitation of migrants. 100 crores for an integrated expatriate employment program. The first one is helping a digital employment program for the educated ones. The second one is to give them an assistance, a loan-based assistance for the entrepreneurial activities, for the business activities. There is already a program which is existing in Kerala, with the Kerala government. That is the non-Kerala project for the return migrants. If the migrants, when they return, they can get a loan of 30 lakhs. In that 30 lakhs, they can start, they can invest in service sector, they can invest in manufacturing sector, they can invest in the agrarian sector. They can get a loan to start a farming, a poultry, horticulture, floriculture, even beekeeping, fish farming, anything. A 30 lakhs is available. In the same model, one of the countries in South Asia also we can see the same model, because upon the arrival here, all the Keralites got around 5,000 rupees. That means roughly around 45 crores we have spent for the returnees who reached here, giving them 5,000 rupees along with these loan facilities. Even Bangladesh also have these loan facilities. Bangladesh also, the Bangladeshi currency, they have given 5,000, and also 3 to 7 lakhs they have given them as a loan for the loan facility to start a different program. But Kerala is going one step ahead. Even they have because Kerala is also known for cooperative societies. So if the Pravasi or the migrants, they want to start a cooperative society, there is also a scope. They are giving a seed money of 3 lakhs rupees for them to start the program. But the real issue is not that. As a Keralite, I think I should be truthful about certain things. We talk about the very enlightenment Kerala. We talk about the Kerala model of development, a role model for all the world. But there is some issues regarding the work environment and work culture. That is where our challenge will be for the reintegration of these migrants. I want to explain that. That's why I mentioned before, there is a higher secondary educated migrants in large numbers in the Kerala migrant stock. According to the Kerala Migration Survey data of CDS, there is hardly any illiterate in the Kerala migratory. When they did the survey in the migratory stock, there is any illiterate. Therefore, what is the problem is these educated ones in Kerala. This is from the beginning. This is the problem. It's finding it a bit difficult to get into, technician as a plumber or as a blue collar job, or into an agriculture or a construction sector. There is some kind of a stigma which is existing in Kerala. There is some kind of a stigma or a complex that these migrant folks are unable to get into these kind of jobs in Kerala because of many issues. So therefore, what is happening in Kerala is a replacement migration. What is a replacement migration? The Kerala migrant, imagine from a town, he is a plumber or even a construction job he is ready to do in Gulf in an adverse climate. But he is not ready to do in Kerala. And who is taking his job? His job is taken by the migrants from Bihar, from Bangladesh, or from near North Indian states. So a migrant from a town in Tiruvalla, that is called a replacement migration. He is a plumber, he is going to Gulf, and his job is taken over by a North Indian migrant. So this is actually the problem of Kerala. So how to reintegrate these group of people is going to be a task. So that is a main task, which not many Malayalis will speak, but I am ready to speak it openly because that is the reality. That we have to accept it. So therefore, that challenge we have to take. To take that challenge, a service environment, the work environment has to change. There, what I am suggesting, and many of us are suggesting, is some kind of a service portal, like in Western world or abroad, where you can just register that if you need a plumber or a technician or electrician, you just register and they will come and do your work, and online you do the payment. There is some kind of a makeshift in the entire work environment. So that is what even we are suggesting. For example, I will tell you one example. I went to my village in this month of September. There is a civil contractor who does cleaning and other things there in the village. I told him I have to get my house clean and my property and other things. He said very difficult because all my employees were from North India and from UP, Bihar and Bangladesh. They all left. I am only left with 5 people. So I was wondering, the same time when he was talking this in September, I could figure out minimum 50 Malayali migrants who have returned, who are doing almost the same job abroad, who are there. But it is very difficult for them to accept this reality at work. So this is actually a problem which we are facing. Anyway, we hope we'll come out with some plans to integrate these migrant workers. And finally, we have also started a skill repository portal that is basically to map the skills and also create some kind of a database so that it can be a bridge between an employer and these employees, because there are domestic as well as international employers. When they ask for a bulk workforce, we will be able to match, and the NORCA is sort of doing that, and I hope they will be successful in that. Along with that budget, the government is also proposed an online meet of the migrants in panchayat level and municipality level. That means at the local level, to integrate them, to understand their problems, to understand their issues. So this is what we are in a larger level we are planning. So I think this is the overall picture I want to give about Kerala migration, COVID situation, the reality, and the way ahead. What is how to deal with this? I will not talk much. I will stop here, and I would happy to receive questions.